So we're going to talk about allergies and nasal obstruction. And if standing here is okay, I think it'll be a little easier for everybody to see me. And if you can't hear me, just call out and I'll be happy to raise my voice accordingly. So I give a lot of talks and specifically on allergy. This is the first time I've spoken specifically on allergy in a long time. And allergy is something that we deal a lot with in ENT and affects folks in different ways. And it's a very broad topic. So I'm going to focus the talk today on mostly the nasal aspects of allergy. Okay, as I said, I give talks, and this slide shows the prevalence of allergy in the United States, and it's got a pie chart and that kind of thing. I don't like these slides, so if you're here to see a bunch of data, you're in the wrong place. Okay, I like to keep my talks informal. Let you ask any questions that you have. This is my son back when he still dressed up for Halloween, and he still thought it was cool that I was a doctor. No longer are either of those the case. So anyway, we're located just across the parking lot here, and we do all range of ENT, and I do facial plastic surgery, as she said. But we'll focus on these primary things. Like I said, allergies create a lot of problems, okay? So I hear all of these complaints. I'm just going to read them out to us. Doc, I got sinus. You know, what does that mean? Well, do you have chronic sinusitis? Do you episodically have congestion? I get dizzy when I get sinus, okay? Dizziness. Dizziness, we're discovering more and more, is related to allergy and certainly can be exacerbated by anytime the pollen begins to collect on your cars, which is getting ready to happen in the next few days. I can't get air, okay? So I can't breathe well through my nose. I can't breathe. My ears pop all the time. Sometimes you'll notice your ears pop when the airplane begins to descend. If you fly commercially and you get up about 30,000 feet, you'll know when the flight is getting ready to descend because the babies start crying. And that's because their ears can't pop the way that adults' ears can. And so that's when you know, before the pilot tells you he's beginning his descent into Charlotte, you'll know because the kids will start crying. My nose runs like a faucet, so runny nose, post-nasal discharge. And then one that's particularly relevant in my facial plastic surgery part of my practice, my eyes are puffy and I have dark circles, okay? A lot of folks, and this is called healthy woman, but I've got another of my gender back there, and we were joking about how great our haircuts look today, and but I see a lot of women for eyelid surgery, and oftentimes it's actually allergy that's causing these puffiness and dark circle complaints. So there are a couple of terms that you may hear with allergy that again have some relevance, and this right here is what's called an allergic shiner. Okay, so sort of like a black eye that doesn't seem to go away or gets worse when the pollen's out. The reason for this is because the eyelid blood flow, the return of that blood flow back to the heart, shares the nose, okay? It actually has to run through the nose to return back to the heart. So if your nose is congested, your sinuses are congested, you've got allergies, then it backs the blood flow up, and you've got very thin skin in the lower eyelids, so it actually does cause a darkening or a puffiness of your lower eyelids. This is this little crease across this little boy's nose is the allergic salute. So this is the allergic salute, and you see the kids do it, and it causes actually a little crease there. This is severe allergies. You can see these are called Denny's lines. These are all just terms that we deal with, and again, Again, this is something that occurs because he can't breathe well through his nose, so he licks his lips all the time and gets eczema. Eczema is another manifestation of allergies. So this is the war room when we took bin Laden, and Hillary Clinton took a lot of grief for holding her hand over her face like that, but actually when she explained it, it was because she had allergies. Okay, so it affects everyone, and so clearly that's what we're going to talk about. Okay, nasal obstruction is where I want to again focus the talk. And once again, let me tell you, until the first person starts asking questions, everybody's always nervous about asking questions. Once somebody starts asking, then I'll hear a bunch of questions. So please feel free to stop me, ask me questions, just raise your hand, I'll be happy to answer them. And I'll talk about any part of allergy that anybody wants to talk about, okay? But again, focus here on nasal obstruction. So another slide that I don't necessarily love, but if you look down at the bottom, if you can see down here, that's the swollen, puffy eyes. And all this is the reason biochemically and from a histopathologic perspective. Let me put this in English for you, okay? So when the pollen is on the car and you sniff it in, okay, there are cells called mast cells, okay, mast cells that are circulating around your body and are in a high concentration in your nose, okay? Some of these mast cells recognize pollen, the antigen, that then connects to that mast cell, and the mast cell explodes, okay? Here's a picture of it exploding. So the mast cells in huge quantities just burst and release a bunch of chemicals, okay? The one that we're most familiar with is histamine, okay? So when you take a Claritin, you know, Zyrtec, Allegra, any of those things, those are antihistamines, okay? So they're designed to fight the effects of just some of those chemicals, okay? There are other chemicals called leukotrienes, substance P, I can't even read these things, but anyway, there are other chemicals that are released, and the pharmaceuticals companies are constantly trying to find these chemicals, okay? But unfortunately, we don't have all of those chemicals. I mentioned leukotrienes. If you've ever heard of Singulair, Singulair is another allergy medication. So how do we essentially fix it? How do we manage these problems? First of all, we've got to identify it, okay? And one of the things, as I said, I speak to a fair number of groups throughout the year. A lot of them are primary care doctors that are doing continuing education, and I have to reiterate the fact that this is a real problem. Okay, and one of the things that has helped us to be able to emphasize this with primary care doctors is quality of life impact studies. Okay, if anybody here knows someone with congestive heart failure, okay, congestive heart failure, it sounds bad. Anytime you got heart and failure in the same sentence, it's got to be can't be such a good thing. Well, congestive heart failure, when compared to chronic sinusitis is actually worse on your activities of daily life or your quality of life, okay? So that kind of puts it into perspective for my primary care colleagues and the importance of identifying this. Then how do we treat it? Well, we want to balance the strongest treatment with the least side effect, okay? Well, as the kids say, no duh. I mean, that's what we want to do, is have the best treatment with the least side effect. And from a doctor perspective, we're all concerned about what your compliance is going to be. So I can write you for an Allegra, I can write you for a Zyrtec, but if you don't take it, it's not going to help you, okay? So I need to find something that you can comply with, okay? And most of the time, that has to do with the least side effects. So we end up being on the same page. Another slide I don't necessarily love, but a lot of information on here discussing antihistamines, okay? Antihistamines with decongestant. Let me pause there for a second. I don't like anything with a systemic decongestant in it, okay? And I'm sure several of you probably come to a lot of these talks. as an aside, the food was awesome here, and which is double-edged sword. Now I know they can make really good food over at the hospital. But anyway, decongestant, systemic decongestant, that's your Sudafed, Actifed, Zyrtec D, Allegra D, Claritin D. They all work by making your blood vessels go into constriction, okay? So sort of squeezing down of your blood vessels, which is great for your nose. That makes you feel great. It opens your nose. The problem is it does the same thing to your heart and to your brain, okay? So people that I occasionally see have been on an Allegra D for 20, 25 years, and now they're on a blood pressure medicine or 2 or 3, which is what we call iatrogenic blood pressure problems, okay? The doctor has created a problem or has created that blood pressure problem by using the systemic decongestant. So I mention it only to condemn the use of systemic decongestants, okay? Intranasal steroids, okay, that's your Flonase, Nasonex, you know, the nasal steroid sprays. They work by actually stopping the mucous membrane or the skin on the inside of your nose, essentially lessening that reaction to the chemicals that those mast cells have burst and released, okay? And then there are some anticholinergics, that's things like Atrovent, that kind of thing, okay? So let's say you come in to see me and you say, well, you know, Dr. Clark, I know that you don't like systemic decongestants. I've been on Allegra D for 5 years, and thankfully my blood pressure isn't up yet, but it's trending that way. So how do I, as your doc, look at you and say, well, just stop the Zyrtec D and not give you anything to help you, okay? Well, what I need to do to help you is generally open your nose. And there are 2 reasons why your nose isn't necessarily working well. One is it's too small. The holes inside your nose are too small. The other is the mucous membranes are swollen, okay? And that's where allergy comes in. Again, why does it matter? These, I put this on here actually. I don't love just a word slide, but it's funny because what we do in medicine is sinonasal outcome test, the SNOT 20. I mean, how do they come up? Anyway, so greater emotional impairment than congestive heart failure or recent MI. Okay. Once again, it's an important issue. So when I approach the nose, you know, I love having medical students and residents and fellows come rotate with me because then I can quiz them on all these little anatomic landmarks and that sort of thing. So when I approach a nose, I've got to approach it from how can I make the mucous membranes smaller on the inside, but not affect the structure of all these cartilages and bones and ligaments, and actually muscles are important in your nose as well. And again, it affects chronic sinusitis, just not being able to breathe, obstructive sleep apnea. You probably have a talk on that at some point during the year. Obstructive sleep apnea, the first place you take air into your body is through your nose, so it affects this. Eustachian tube function, I talked about the babies on the airplane descent, that's when they start crying. The nose is like a pyramid. So you've got a sidewall on one side, a sidewall on another, a strut up the middle. If you've ever heard of a septum, a nasal septum, septoplasty is sometimes done. And then in 3 dimensions, there's the dorsum as it goes up the nose. And then the most important thing from my perspective is the nasal valve. And if you do something, do me a favor and just take your fingers and feel the hard part of your nose, run down to where it sort of drops off. Okay? Take a breath through your nose and just rest your fingers on your nose and take a couple breaths through there. That's what it feels like for somebody who can't breathe through their nose all the time. It's not a very comfortable feeling, okay? And the reason is what you've just done is you've taken this cartilage and just narrowed it a little bit. You don't have to squeeze on it. You just rest your fingers there and it makes it uncomfortable for you to breathe. That's why Breathe Right strips work. Okay, so if you've ever had a friend that uses Breathe Right strips, and we've seen them on television on the running backs and the football, basketball players wear the breathe right strips. They're opening that up. Now, if you do one other thing, and I'll answer your question in just a second. One other thing is take your fingers and pull on your cheeks. Now feel. It's a lot better. A lot better. Okay, so what you're doing now is you're opening, okay, you're opening that nasal valve area. Okay, so, and essentially that's when I operate on somebody, when I do surgery to try to open someone's nose, that's what I'm trying to do, is give you that feeling of good airflow through your nose. One of the things that I do on pretty much a daily basis is reconstruct the inside of the nose to make it more open. And these are some descriptions of how, depending on your ethnicity, gender, age, how these cartilages intersect with the top of your nose. And sometimes it's good, sometimes it needs to be made better. The lower lateral cartilages, these are the cartilages in your tip, okay, usually are fine throughout your life unless you have surgery on them. And if you have surgery, think Michael Jackson, okay, and you have multiple surgeries or too aggressive surgeries, that can also create a problem. So when we're talking about doing nasal surgery, okay, how do I get inside the nose? Sometimes I make a small incision on this part of the nose, the columella, and sometimes all I do is make incisions on the entirely inside of the nose, behind the columella. And from the inside, it's amazing what you can see. You think these little nostril holes are small, but I can see pretty well to all the way up to the to your forehead through the inside of your nose. And so, what I did, as I said, with her is take a sliver of cartilage, insert it in there, do some little fancy suturing, stitch things back together at the tip because her tip was asymmetric, and then, you know, after it's done, you can see the nose is straighter. It doesn't have this curvature, that concavity on that side, and most importantly, she can breathe, okay? She can breathe well, and also, very importantly, from my perspective in doing the facial plastic surgery, is if you looked at her, you wouldn't know she had a nose job. And that's what I want, is for her to look very natural, okay? Now, to segue back into the allergy part of the talk, she may still have difficulty with seasonal allergies, okay? She may still need Flonase when the pollen is really bad on the car. She may still want to use an irrigation to keep that liter of mucus flowing, okay? But her holes are big enough now. Remember, nasal obstruction, either the holes are too small or the mucous membranes are swollen, then she can deal with the swollen mucous membranes a couple of months a year and is much, has a much higher quality of life, all right? This, you know, we can refine the tip just a little bit, and I know it's very subtle, but it's a little higher on this side, a little lower on that side, much more symmetric, and that's what the incision looks like after it's healed. So, to sort of reiterate, don't want this, want this. Don't want that, don't want to just cut everything out and let it collapse into the face. We want to have good structure of the nose.